ask if does this change anything with current restriction rules at all? Do you now have to review anything?
Well, look, this is very early, and no doubt I'll expect other cases. If there is one case and we don't have an immediate source, if there's no direct connection that we can establish, we have to assume there are other cases. That's why all of us need to be on guard, and our response will be proportionate, as always has in New South Wales. So we'll assess the situation. Obviously, we expect a high number of people to come forward to get testing. In the last 24 hours, we had 13,500 people come forward and get tested. No doubt this positive case in that part of Sydney with the venues that have been identified will alert more people to come forward and get tested, and that's a good thing. But our response will be proportionate to the number of cases that are established, the geographic location of the cases, and whether or not they're in isolation. So this is only a couple of hours into us being aware of what's going on, and our response will match, obviously, what we find out in the next few hours and in the next few days.
Premier, are you concerned this will affect the bubble with New Zealand?
Well, I hope not. New Zealand had more cases and we didn't even flinch. So we are going to get more cases during a pandemic. We have to be very aware of that. And New South Wales always has the highest risk given the number of people coming in through overseas and the fact that our borders are open. So we always have to be aware that this risk is amongst us. And as I travel around the state, it's very interesting. Different parts of the state are more complacent than others. But when there is a case and we don't know the source, all of us have to be on guard no matter where you live, because it could have been someone who came in from a different state, a different city, or we just don't know yet. So therefore, all options are on the table. We can't speculate. It's way too early. But it also means, unfortunately, we can't rule anything out. So everybody in the state needs to be on high alert. Anybody anywhere with the mildest of symptoms needs to come forward and get tested. And certainly if you've been in those venues at those times and you have the mildest of symptoms, come forward and get tested or follow the health advice. During the day, Dr. Chan has already announced a number of venues where this person was at. But during the day, health might revise its update from saying a casual contact to a close contact. And if you're a close contact, you have to get tested and stay home and get isolated. So obviously it's really important for people to follow the health advice, newsouthwales.gov.au or New South Wales Health, and make sure that that information is at your fingertips, or that you're aware of what's going on so that you can act appropriately, because the more people that come forward and get tested, the more quickly we get on top of this current outbreak, the less we'll have to respond in a milder way than otherwise anticipated.
This man was in his mid-50s or in his 50s. People over the age of 50 in the phase 2A of the vaccine rollout are now eligible for an AstraZeneca shot, but phase 2A general public can't get an AstraZeneca shot in the New South Wales health vaccine system yet. They can in Victoria. Does this case change your mind at all on the May 24 opening date for New South Wales health clinics to start booking for general public in phase 2A that want an AstraZeneca shot?
Well, look, we know that there's nearly 3 million people in New South Wales over the age of 50, so there's no way we would have vaccinated 3 million people by now, which is the message. But as Dr. Chan said, even if you have been vaccinated, as I have, it doesn't mean you can't get it, and it doesn't mean you can't pass it on. Obviously, the chances of those two events are massively reduced when you have the vaccine, and obviously severe disease is prevented. But we have to be aware that under the current circumstances, when the vast majority of the population isn't vaccinated, all of us have to comply with existing processes in relation to health. And we also have to be aware that irrespective of whether we've been vaccinated or not, we have to take these precautions, and that is really critical. The other issue that I want to stress at this point in time is that we know the task ahead of us in New South Wales, and I can't urge enough how important it is for people to get vaccinated. On Monday, the mass vaccination hub in Homebush complements already the 5 major hubs we have, plus the 100 sites we have around the state. The GP network from the following Monday will take people over the age of 50. We encourage everyone to come forward and get tested. If you have any issues, you can talk to your GP about that. And obviously from the following week, everybody over 50 will also be able to go through the New South Wales health system. But please note that we still have people who work in areas where they have contact with hundreds of people every day that have to have the vaccine. As you can appreciate, school teachers, bus drivers, we're really keen in New South Wales to get people who've got contact with lots of people to get vaccinated first before we open up to all categories. And I appreciate New South Wales has always done things differently during COVID. We don't apologise for that, because we want to make sure we reduce the risk of major community transmission of major seeding events. And that's why it's really important to us to make sure that we've vaccinated all those categories of people that have a lot of contact with others who unintentionally, if they did have the virus, would spread it to a lot of people.
What plays a